Hello and welcome to the video on your genitourinary health in pregnancy. We are going to cover UTIs, we are going to cover vaginal infections, and we are going to cover Pap tests. So let's start off with urinary tract infections, why we screen for them, why they're important, and what we can do about them. So, in pregnancy, frequent urination is common. Why this happens? In your first trimester, as early as about 5 weeks, a combination of the uterus expanding but not yet out from under the pubic bone and compressing the bladder and the hormonal changes that happen, which increase blood flow through your kidneys and therefore urine production, cause you to pee a lot more. You often get a little bit of relief in the second trimester as your uterus stops compressing your bladder so much, but then that comes right back around in the third trimester when your bladder is displaced by the weight of your baby. You also have your peak blood volume around 32 weeks pregnant, and that is a lot for your kidneys to filter, so lots more urine. So the baseline risk of getting a urinary tract infection does not increase during pregnancy. However, if you get one, because of everything we just talked about, you may mistake it for normal pregnancy symptoms. And if you get a UTI, due to the relaxing effects of the pregnancy hormone on your ureters, or the tubes that connect your bladder to your kidneys, it is easier for bacteria from a UTI to cause a kidney infection. So we screen every pregnant client for asymptomatic urinary tract infections in the first trimester. If you have a history of frequent UTIs or develop one in pregnancy, we will screen you more frequently. If you have signs or symptoms of a UTI, such as pain or burning on urination, blood in your urine, abnormal abdominal flank pain, or fever, please let your midwife know. When not accompanied by any signs of infection, frequent urination is normal and not harmful. It's important to keep hydrated despite frequent urination. A side note, sometimes strain on the pelvic muscles causes stress incontinence, for example, peeing when you laugh or sneeze. This can be addressed by pelvic floor physiotherapy in pregnancy or in the postpartum. If you have a UTI, your midwife will contact you to prescribe antibiotics that are safe to take in pregnancy. It is important to let your midwife know of any medications you are currently taking, as well as any allergies to medications that you have. Other things you can do to help clear a UTI include drinking cranberry juice, not cranberry cocktail, cranberry juice, taking cranberry supplements, or D-mannose supplements. All right, so vaginal infections. It's really common in pregnancy to have an increase in cervical discharge. It's just a normal way that your body is changing during this time. But if you notice that you have abnormal vaginal discharge or itchiness in pregnancy, please let your midwife know. You might be offered a vaginal swab for common genital infections such as bacterial vaginosis, yeast, or trich. So BV, or bacterial vaginosis, is the most common lower genital tract disorder among people with vaginas of reproductive age, pregnant and non-pregnant. And it is the most prevalent cause of abnormal vaginal discharge and malodor. BV is a polymicrobial syndrome resulting in decreased concentration of normal vaginal bacteria and an increase in pathogenic bacteria. In symptomatic pregnant people, testing for and treatment of bacterial vaginosis is recommended for symptom resolution. You will not be routinely screened for BV in your pregnancy unless recommended by your midwife due to a history of preterm birth or preterm pre-labor rupture of membranes. Yeast is another very common one. It affects 75% of people with vaginas at least once. Vaginal treatments are recommended in pregnancy over oral treatments and can be found commonly over the counter. So what we recommend in this case is to wear breathable cotton underwear, don't douche or use scented products, and reduce your intake of refined sugar. If you think you have a yeast infection, please let your midwife know. The other one is trich, or trichomoniasis, and it is a very common sexually transmitted disease. It is caused by infection with a protozoan parasite called Trichomoniasis vaginalis, and although symptoms of the disease vary, they can be similar to yeast infections, and most people that have the parasite cannot tell that they are infected. So the symptoms of these three infections are similar in some ways and different in others. The treatments are slightly different. So with vaginal irritation or altered discharge, it is important to get a swab so that we can assess what is going on and what the best route of treatment is. We do offer routine screens in pregnancy for chlamydia and gonorrhea, and that is because these ones can have an impact on the baby when they are born. So universal screening is recommended by urine sample or self-vaginal swab. People who have chlamydia during pregnancy tend to have higher rates of infection of the amniotic sac and amniotic fluid, preterm labor, and preterm pre-labor rupture of membranes. So up to half of babies born vaginally to parents with untreated chlamydia, and even some babies born by C-section will contract the infection, and they can develop an eye infection or respiratory complications like pneumonia. All of the infections discussed here can be safely treated during pregnancy by your midwife or family doctor. Now, last but certainly not least is Pap Smears. So this is a very important part of your ongoing health care as a person who has a cervix and a uterus. So the purpose of a Pap smear, which is a screening tool, is to reduce the risk of cervical cancer through the detection of lesions on the cervix that have the potential to become malignant. For people with a cervix who are sexually active, screening should start at 21 years old. For those who have not been sexually active by 21, they can wait until they become sexually active before they get their first screen. Screening then continues until you are 70 years old. HPV, or the human papillomavirus, is found to cause infections in the cervix, which changes the cells. HPV is a sexually transmitted infection that many people never develop symptoms for, although some people may get genital warts from some strains. A Pap smear is a screening tool used to detect the cellular changes caused by HPV. It is not a diagnostic test and does not tell you if you have cancer. If your screen shows cellular changes, it may be repeated or you may be referred for further testing. Routine screening is done every 3 years, and increased screening is done if there are risk factors or cellular changes are seen on your screen. A Pap smear is done by your healthcare provider. It involves an internal pelvic exam with a speculum and a sampling of cells taken from the surface of your cervix with a small spatula or broom. Your midwife will show you all of the equipment and walk you through the procedure before they start. A PAP should not be painful, although you may feel pressure or discomfort. If you have a history of vaginismus or painful vaginal insertion, please talk to your midwife about this procedure and options like pelvic floor physiotherapy to help you. Each year, 500 Canadians will be diagnosed with cervical cancer. It is really important to screen. Your midwife will request your last PAP from your healthcare provider who did this for you. And if you are due from a screen, we can do this in the postpartum. You can do a PAP safely in pregnancy, but due to the increased blood flow to your cervix, it can be a bit more uncomfortable or can cause bleeding. This bleeding is not dangerous to your fetus, but if you are not at a high risk for cervical cancer, we usually wait until the postpartum. So, how do you prepare for a Pap smear? Please avoid having intercourse 24 hours before the screen. Don't use vaginal medications, douche, tampons, or contraceptive creams for 48 hours before the test. Avoid having the test done during treatment for any cervical or vaginal infections. Empty your bladder and bring a pad or panty liner for afterwards in case you experience some spotting. If you have any questions or concerns about this screen, please, of course, talk to your midwife through it, and they can walk you through the entire thing and address any questions you have. And that is my talk on your genitourinary health in pregnancy and afterwards. I hope you found it informational.